A renowned cardiologist, Dr. Cabral was once the chief of cardiology of the Asian Hospital and Medical Center and director of the Philippine Heart Center. Let us all give a warm welcome for Dr. Esperanza Cabral, who will present the highlights of today's session.
Thank you. Thank you very much. And I want to thank you and congratulate you for your fortitude. We have been here for 10 hours. So I have the enviable task of closing this program. But before we breathe our collective sigh of release and relief, I also have the function of synthesizing what we went through over the last 10 hours. The morning session of this forum had us in the health sector continuing to talk to each other on this topic of health for Juan and Juana, but also inviting the non-health organizations to put health on their agenda. Representing the Asian Development Bank, Dr. Sun Man Kwon enumerated priority areas: financial protection, sources of funding, population coverage with emphasis on the informal sector, service delivery and providers, and governance and accountability. Our major host, PHAP, acknowledged the role of various sectors in achieving universal health care, in strengthening primary care and outpatient systems, involving all of government, especially local government units, while engaging the private sector and other stakeholders, and keeping focus on patients and their power of choice. We also heard from Secretary Garin our imperatives, detailing the complex patient journey through the Philippine health system and emphasizing the urgency to address the gaps and challenges of healthcare. Dr. Vivian Lin highlighted the need to clarify roles and developing linkages and extending service coverage, strengthening the Department of Health's role in supervision and oversight, and integrating and aligning systems. A video message from Secretary Ubial reported on the gains on the 3 guarantees of the Philippine Health Agenda and its performance within the first year of the new administration's Philippine Health Agenda is reassuring. She likewise pointed out the value of advancing health promotion and primary care, and this is where we see opportunities to improve health literacy with help from other government and non-governmental agencies. The battle cry of the Department of Health, all for health towards health for all, echoes the call for broader involvement and commitment towards achieving universal health care. We heard from Assistant Secretary Carlos Bernardo Abad Santos of NEDA on the importance of health as a part of the broader goal of achieving human development, as expressed in the 10-point socio-economic agenda of the current administration, Ambisyon Natin 2040, and the Philippine Development Plan. Accelerating human capital development is acknowledged by NEDA as key to reducing inequality, improving access to economic opportunities, and ensuring that no one is left behind. Finance Secretary Carlos Dominguez was clear that access to health care is the most important measure of inclusive human development, while posing the challenge of looking after the health of the young and the urgency of expanding access to health services. He pledged the Duterte administration's increased investment in human capital including scaling up health services. So we really had a good time, a lot of learnings, and a lot of opinions were expressed. And I hope that coming out of this hall, we are all going home more committed to providing healthcare services, especially to those who need it the most. Finally, PHAP has engaged the services of SurveyMonkey to find out what really the people in the audience thinks of universal health care. And I think that from the looks of it, we are on the same page. People had different words to define universal health care, but they all mean exactly the same thing. Some people call it health for all, others call it equitable health, others better health outcomes, a holistic approach to health access, whether one is rich or poor, access to an integrated health system, quality health care, reaching the most vulnerable, leveraging taxes to fund and drive healthcare programs, and access to affordable and quality medicines. And the second part of the survey asked the stakeholders of their interest in the full implementation of universal health care and relevance to other specific health concerns. And some of the comments were, make health care a right, not a privilege, hoping for health care access for all after this forum. Others wanted to learn more about the national mental health care delivery system. Others wanted to reference traditional indigenous medical practices, and others wanted more investments on health centers, clinics, and hospitals to benefit all. As in the previous forum last year, I said, we've been talking about this thing for ages. Now, really, it's time to move and take action. Thank you very much. Good night.
Thank you, Dr. Esperanza Cabral, for giving a proper close to today's forum. We request you to post your insights or reflections for the country to achieve universal health care. And that wraps up today's forum. As Dr. Cabral highlighted, we hope that this forum will translate to action